If you're experiencing sharp, stabbing pain with your first few steps when you wake up or stand up, you're not alone. Let's talk about how to fix it. Plantar fasciitis is one of the most common causes of foot pain, typically presenting with sharp, localized pain under the heel or along the foot arch. Classically, pain is worse the first few steps after not moving for a while, say getting out of bed or standing up after a period of rest. After moving a little bit, pain may improve due to something called the warm-up phenomenon, but will worsen again with continued activity. Here's what's going on. The plantar fascia is a thick band of connective tissue stretching from heel bone to toes. It supports the foot arch, allowing our feet to store and release force we place through the feet with every step. Historically, when the fascia became painful, it was thought to be due to inflammation, which is why it was previously called plantar fasciitis. The itis ending denotes inflammation, but we no longer use it. We learned the real issue is tissue degeneration, so think weakening. For this reason, we now call it fasciopathy rather than fasciitis. Why did this happen? It depends. We can loosely divide people into 3 groups. Group 1 is the person who increased their activity level faster than their body could adapt to it. For example, a runner who went from running 2 miles a day to suddenly 10. Or the inactive person who just started being active. Group 2 is the person who chronically does too much and does not give their body a chance to recover, like a high volume distance runner who never takes a day off. Group 3 is the sedentary person. This one is harder to understand. Basics are, with age, our body slowly loses ability to handle physical demand. We slow the rate of loss by being active, but if we are inactive, it happens faster. Eventually, we become deconditioned enough that even simple tasks like walking are more than the body is adapted to handling. Finally, overall health also plays a role. Poor sleep, diet, obesity, diabetes, smoking, etc. make us more susceptible. People know this and get tired of hearing it, but it's worth pointing out. It means you have many other ways to improve your condition. Weight loss, quitting smoking, eating better, sleeping better are all ways you can help your pain. Likely your biggest question is how long will it take to get better? It varies and is not easily predictable. There is some thought in the research that 50%, half of people, will improve every 3 months that go by, regardless of how we treat it. If so, it's just a matter of waiting and hoping we get lucky. Additionally, data shows around 80%, so 8 out of 10 people, will have their pain completely resolve within 1 year. However, this also means at 1 year, 20%, 1 out of 5, are still expected to have pain. Unfortunately, we lack data to tell us if they continue improving after that year though. Takeaway, expect at minimum 3 months to recover and be prepared for recovery to take up to 1 year or even a little more. As for treatment, physical therapy is the primary option. We have others we'll cover shortly though too. Let's explain why PT and how to think about it. Big picture, problem is our plantar fascia can only handle this level of force and load, but we are currently placing this amount on it with our life and activities. Our approach in PT is twofold. First, early on when we have a lot of pain, we scale back what we're doing. Walking less, working out with lighter weight, taking more breaks from standing, etc. to pull the force and load closer to what the fascia can handle. This should mean less pain and a less irritated tissue. Idea being, we're giving it a chance to calm down. Second, we introduce PT exercises and gradually ramp up our activity as pain allows, to build up how much load the fascia can handle before pain. Goal is to raise the bar from here to here. It's a slow process, but eventually we get to where the fascia can tolerate this amount, above what our prior activities demanded, at which point we should be able to return to them with less or no pain. We have many exercise options. Here's a potential series. This first set is easiest and best for someone with high pain levels. The stretch can be continued all throughout recovery. It sounds odd, but there is research showing the stretch alone can help. Second set is harder. I would continue both through your recovery, just adding weight or thicker bands to increase difficulty when things become easy. This final set is the hardest on the plantar fascia. I would add these once you can do so with a tolerable level of pain. It may take spending a few weeks doing the easier exercises before you can do so. If you want more exercises or a more structured week-by-week program, then check out my phone app. Here is the set, rep, and difficulty scheme I would aim for. Pay special attention to the pain level. We want to push as hard as we can, keeping pain below 3 to 4 out of 10. both during performance and 24 hours after, because sometimes pain is delayed. This is how we decide if an exercise is too hard and if it is appropriate to progress to harder ones. Let's chat equipment. 4 items frequently come up. None need to be used. They're all entirely optional. First is inserts. Research only supports specifically silicone heel inserts being helpful. Second is orthotics. Neither off-the-shelf or fancy custom orthotics have been shown effective in the research. So don't waste your money. If you're stubborn and really want some, get the off-the-shelf ones from CVS or Walgreens. Research shows those are equally effective as the fancy custom ones. Third are night splints. These seemed to make sense as studies showed stretching helps, but the studies looking at night splints themselves found they didn't help, so I wouldn't bother. The fourth thing is shoe wear. How much to worry about this depends on your day. If most of your day is on your feet, especially on concrete, then importance is greater than if you sit at a desk. Simple tip is consider trialing shoes with thicker heels or more cushion. No shoe is good or bad, but thick shoes redistribute load to your knees and hips, shifting it away from your ankle and painful plantar fascia. What about medications? Unfortunately, we don't have anything that works. People jump to NSAIDs like ibuprofen, but studies show these are not helpful in plantar fasciopathy. In a study, they gave one group of people NSAIDs and the other a placebo, so a sugar pill, and found no difference in pain or symptoms between those two groups, showing the actual drug didn't help. Unfortunately, we don't have any other medication to offer. Nerve meds wouldn't work because it's not a nerve problem, and opioids are not appropriate here. What about injections? We have a few options. Most common is a steroid, and research shows they are effective, though only in the short term. But the injection is not expected to fix or cure anything. Best evidence is pairing it with exercise, i.e. physical therapy. In one study, individuals who received the injection paired with PT had a 20% greater pain reduction compared to those who only underwent PT. Downside is steroid injections come with risk. They weaken connective tissue like the plantar fascia, especially with repeated performance. So long term, there is concern it may increase risk of the condition worsening or even the plantar fascia tearing, though this is very unlikely if you only get one. There are other injections like regenerative medicine, PRP, prolotherapy, etc., and these do not have the rupture risk but are newer with less evidence demonstrating their effectiveness and tend to be expensive. So you can get them with less risk, but we cannot confidently say it will help. It's a bit of a gamble. What about surgery? It's an option, but very rare. Less than 2% of those with this condition undergo surgery. Research does not support it being effective. In studies, effectiveness of surgery was comparable to just getting a steroid injection. So why choose the extra risk? If surgery is considered, it will only be for someone who has significant symptoms and tried PT for 6 months to 1 year without success. At this point, it's just a last resort, hoping it will help, but again, no guarantee. What they do in surgery depends on your specific case. Typically, it is a fasciotomy where they cut part of the plantar fascia and possibly reattach it elsewhere to relieve tension within the tissue. They may also try to clean out any debris that is noted. Finally, our bones vary in shape. If yours are shaped in a way that irritates the plantar fascia, the surgeon may shave down or remove that part of the bone. So that is what is going on and how we approach treating plantar fasciopathy. Good luck with your recovery.